Hi, my name is Joseph Manacop, and this is my video for on how to prime the IV tubing. Just like everything else, you do hand hygiene. You go in the med room, you check the MAR, you confirm the patient's name and date of birth, check if the patient doesn't have any allergies, and check the reason why. Confirm the reason why the patient's ordered the fluids. You gather up all supplies, do your hand hygiene, you do your first med check. Again, name, date of birth, the right medication, the right route, which is IV, the right dose, the right time, which is now, and we got a document later on. So you gather up your supplies. For just priming, we got the IV solution, which is a 0.9 normal saline. No, sodium chloride, not normal saline. 0.9 sodium chloride, 100 ml, and then IV tubing. So once you get outside of the patient's room, you bring all your supplies, you do hand hygiene, you do your second med check. Again, the patient's name, date of birth, the medication or the IV or solution that needs to be infused, the right route, the dose, the right time, which is now, and we'll document later on. Once you go inside the patient's room, you introduce yourself, you perform hand hygiene, you explain to the patient what you're doing. You got to tell them that the doctor's ordered IV fluids on you, and tell them the reason why. Maybe the patient's dehydrated, and then ask the patient if they have any questions and if it's okay for us to do it. Again, you do hand hygiene, confirm 2 identifiers, ask the patient their name and their date of birth. After doing that, you do your third med check. Again, you got the right patient, right medication, right route, dose, time and documentation later on. You give the patient privacy, you close the curtain, close the door, position the patient for comfort, and I would, for myself, since I have back issues already, raise the patient's bed up to working level, comfortable working level for you. And once you get done with that, you grab your supplies. Make sure you have you got to check your IV bag. Make sure that it is not expired. Make sure the expiration date is good. Your IV tubings and the rest of the supplies, make sure that it is not expired, and then that the packet is intact. There's no holes, no tears, no moisture in it. And we're going to open up the package. Make sure you have a good working, dry, clean space, by the way. I'm going to open up the IV tubing. First thing I normally do is just turn off the roller clamp here. We're going to label the IV tube. Make sure you have the patient's name, date of birth, today's date, and your initials in it. And then you also initial, time and date, the IV tubing. It says there on the checklist. It gets changed per protocol on the facility, but 96 hours. Okay, first thing we need to do, I did the roller clamp. And now this one's different. Once you open that up and you turn it, it's gonna gush out. So here's your IV bag. You have to Make sure you have a good, keep the tip sterile. Okay, here we go. Turn and twist. And you punch it. And then you invert. After inverting it, fill up the drip chamber at least halfway. And what I would do, anything that has a Y, just for it to prevent any air bubbles, I try to lift up all the Y's. The Y, I don't know what you call it, intersections, whichever. Make sure when you open that up, I can't even see it in the camera, make sure technically it is sterile. Put that cup safely, and what we'll do is we'll hang that one up there, if it'll stay. There we go. I got a trash can there, so we're just going to unroll the roller clamp, open it up, and let the fluids flow. There we go. Check the lines, make sure there are no bubbles. When you are satisfied, roll up the roller clamp again. And if you could, recap that. Make sure you didn't touch the outsides or the inside of the cap. And that is how you prime the IV tubing. Thank you.